Last time, we learned that whatever name you give them, drug price controls will reduce innovation and threaten people's access to medicines.
Pete, we're in the home stretch. Look ahead. You can see the way out of the drug pricing maze. But we still have to collect 3 keys to open the gate and escape.
Where are the keys, Professor?
To collect the keys, Pete, we have to go back to the places on our journey where we saw the problems with the drug pricing system and solve them.
How do we do that, Professor?
First, we need to go back to the drugstore and help lower costs for the patients who buy their drugs at a pharmacy. Remember the patients who weren't benefiting from the lower prices negotiated by pharmacy benefit managers? The current system drives list prices higher, hurting patients who take expensive drugs.
How do we help them, Professor?
Pete, we have to fix how drugs are sold by moving to a net pricing system. This way, patients will benefit from the large discounts negotiated on their behalf, and out-of-pocket costs would be much more affordable.
What else do we need to do, Professor?
See this fogged-up mirror, Pete? That's how clear the information is about drug pricing. But if we made drug pricing more transparent, patients would clearly see how much drugs cost. Drug makers would then have to better compete for their business. This net price model would benefit patients and lower costs.
My glasses make it easier for me to see clearly, too.
And transparency will help patients clearly see drug prices. Pete, one last reform would help Medicare patients. Remember the elderly patients who were on the prescription escalator, paying more for drugs because they take so many?
That was a lot of fun to ride, Professor.
Not for patients on a fixed income, Pete. That's why we need to fix how the benefit system works for Medicare patients, by capping their out-of-pocket costs. Pete, congratulations. We've solved the drug affordability problem for patients who get their drugs at a pharmacy. Collect the first key.
I've got it, Professor.
Pete, your lesson for today is this. Reform should ensure that prices are transparent, easy to understand, and that patients benefit from the large discounts that are being paid.
Join us next time when we learn how to reform the system to expand the affordability and availability of biologic medicines and gene therapies.